hi everybody who's watching this. Today I got Dr. Logan Halderman with me on this Zoom interview. And I know Dr. Logan from back Ohio. He was one of the people who actually helped me out while I was applying to different schools. He and his brother Wes were quite a, I would say, support for me during this process and even when I was moving. So just as a brief introduction, Dr. Logan up here, he's part of the faculty for the AEGD program at NYU Langone. Before that, he was a resident for, he was a AEGD resident at NYU Langone in Ohio. And prior to that, he graduated from Ohio State University in 2015. And welcome, Dr. Logan.
Thanks for having me,
Yeah, thank you.
Adriel. It's been good. I haven't gotten to see you much since you moved to Colorado, but it's good just to reconnect with you.
Yeah, you know how dental school is, right? It makes you invisible.
Yes, and fatherhood.
Oh yeah. Thank you for this. Thank you for your time. And today I wanted to ask you some questions. So there could be people who are international dentists like me, then there are local people, local students who want to apply to DDS programs and are trying to go through the process. So I'm gonna go retrospective with you because I know with the NYU Langone AGD program, they also take international dentists and local dentists as their residents in Ohio, at least. That's what I know, and Massachusetts as well. So, how has your experience been as a faculty member and as a resident of AGD program up in Ohio with NYU?
Well, it's been great. I think that's why I'm still at the same place I did my residency. Actually, I was a fortunate one in that I am basically teaching at the same program that I was originally a resident at. So I was very familiar with the program, and about halfway through my residency year, actually a job opportunity opened up, and so as soon as my residency year ended, I became a a dentist on staff at this health center, and got to just basically continue on what we'd already started, kind of build upon what I had been learning through residency. But it's a great site. I mean, it is in a very small rural town in Ohio, largely helping Medicaid population, underserved population, which is what I have a passion for, and then getting to teach. I don't know if I originally thought that I would like that part, but I tell you, it's been a very enjoyable part for me to have students coming through our clinic. We have actually dental students from Ohio State rotate, but also then we have 2 residents every year through the AEGD program, and so I get to just build into the next generation of dentists, and it's been a very rewarding aspect to dentistry for me. So I've really loved it there.
That's nice. So my question is, if I'm a graduate international trained dentist, or maybe if I'm a local dentist who just passed out of a dental school, and if I'm applying to NYU Langone at the AEGD program, what things should I look into while I'm applying? Like, what are the key things have you seen in common when you were applying and in the candidates that makes their application stronger?
I think it always, I think for me, number one always comes down to communication skills, and just being able to make good conversation, easy to talk to. I think I'm not saying that grades don't matter to some extent, but I do think they don't necessarily make a great dentist. I think a great dentist is someone who cares about their patients, is able to make them feel comfortable share and make good conversation with them. Um, and so we're just looking for that. I think that's a huge skill. I would also add on uh, hand skills is big. That's going to be, you know, we're maybe looking more at what kind of work you did in your lab classes in school. That would be where we can get a good gauge on maybe how your hand skills are doing. And then I think just teachability. I think, I mean, I've seen students come out and kind of act like they know it all. And dentistry is a very humbling profession. We will all make mistakes. I do think it's important to come out and um, just realize that you have a lot to learn still. You know, you're doing that. If you're doing a residency, you're doing it to learn more and to gain more experience. So I think just being humble for me is big, and being teachable. Um, not feeling like you have to come out and know the answer to everything, but to just be, there to learn and ask good questions to the faculty. So those are some things that stick out to me.
So just to summarize what you said, anybody who's planning to looking into applying into dental schools or residencies, you mentioned three things are important. First of all is your communication skill, how you interact with your peer colleagues, with the patient. Secondly is your hand skills, and they kind of get measured through your lab courses and your grades and the stuff you've done back in school. And third is teachability. And I know, like, since I've been mainly engaged with international dentists, is teachability is quite an important thing. You might be the person who knows nothing, but if you have the ability to learn, people would like to bet on you, they would like to teach you. It's kind of like what you see all the boxing movies. You see Rocky, Southpaw, and all the coach pick up a guy who they find is teachable. He's usually not the smartest, not the best, but he's the most teachable person.
Yes, yes. And I mean, I was there. Like I was fresh out of dental school, and I feel like there's a huge pressure to put on this kind of this fake mask all through school. You know, you have to act like you have it all put together, and that puts a lot of pressure on somebody. I mean, a lot of dental students just live with tremendous amounts of stress and anxiety because they're always trying to put this veil of perfection on, and I know that because I tried to do it too. And I think the more that I realized it was okay to be a little broken, and to be a little honest with people that, hey, maybe I don't know the answer to this, or when I make a mistake clinically, to not try to cover it up, but to just admit my mistake. Those things can be really humbling, but in actuality, that takes so much of the stress away when you stop trying to be perfect, and you kind of realize it's okay to be a little bit broken. Um, and actually, I mean, at least for me, like I kind of enjoy someone who's honest about that, it makes them more teachable. I really think, instead of someone who's just trying to, have everything perfect, or putting that veil of perfection on.
So the thing you just mentioned about, and I've heard this, and I'm actually experiencing it myself. Most of the dental students, and especially like me, people who are coming from different countries who are already dentists, they students go through an imposter syndrome where they think they have to put up a mask because the person sitting beside me might have a 20 years of experience in a specific field, and he's going to be really good. And not even just in that, like in DDS, I think in conventional students, some people are really good with their hand skills and other person won't be, and we keep fighting ourselves to put up that mask that I feel is kind of like an syndrome that you have to put up even after, I think, graduation, because one of the professors said the first 3 years of practice is malpractice. I
Yeah,
don't know. I don't
there's some truth to that.
I should be saying that or not, but according to him, like it takes time, and but for the first couple of years we put up that mask like I know everything.
Yeah, yeah, um, agreed. And I certainly wasn't the top in my dental class, and especially not hand skills. I mean, I didn't like. I remember my lab partner was had been a dental hygienist. I think she was actually a hygienist, and for a couple of years for dental school. So she came in with just so much more dental experience, and I just remember things would come so easy to her in lab, um, and they just it took me a lot more time. But certainly it was easy to compare myself to her and put a lot of pressure on myself. But I maybe going back to why you would do a residency, because I mean, reality is there are some people. There's that select handful that maybe have the hand skills to maybe go more out on their own right out of school. Um, there's not many. I mean, I think that's truly a select few. I think for the majority of us, and the reason why I really felt compelled to do a EGD was I just didn't feel ready. And so going to do a program for an extra year, the main reason is to get just that extra experience, um, protection of program and having mentors and faculty members kind of overlooking you still. So all that to say, I mean, you wouldn't do a residency if you felt like you had it, if you truly had it all put together. But 90% of us are still have a lot of growth to do, and I think that's where these AEGD programs are really worthwhile. Is to help get your skill level up and um, make it so that you are ready to go out on your own after that year.
So what's the difference between, I know a little bit, but what's the difference in a GPR and AGD?
Yeah, I don't think there's a huge difference. I mean, they both are 1 year programs, typically 1 year. I think some programs might have a second optional year to it, but typically a year after your dental school, that you're still a general dentist, so you're not specializing as a orthodontist or oral surgeon. You're a general dentist, but it's like advanced training. So maybe you can broaden your skill set. So maybe you come out of dental school, and if you just did dental school, you're mainly just doing extractions and fillings. But if you do a AEGD or GPR, hopefully you're getting some implants or molar endo, things that will maybe allow you to do like a more expansive set of techniques. I really think between both programs, they're pretty similar. I think GPR associated with like a university or a hospital, um, where an AGD is maybe more like in a clinic setting. So GPRs tend to be, I believe, more medically compromised patients. Maybe seeing people who are needing to be in a hospital setting, or might have a little more work with like sedation,
And
which
trauma.
some people would really appeal to that. I think I wanted to get out of that type of setting and more into just a typical dental clinic, things that I'd be seeing more on an everyday basis as a general dentist. So that to me is what I picture as the difference. And there might be some other ones that I don't know about.
Makes sense. I'm gonna. So my next question was that since you talked about these 3 things, and in people who are applying to residencies and schools, what do you think about, like, let's talk about Ohio State University. I know international, even though Ohio State doesn't have a advanced standing program for international dentists, I know a dentist who was trying to apply to schools, who did a preceptorship for 3 months in perio department at OSU, and the candidate got like 5 acceptances in different schools just because they worked up there. So I've heard really good things about OSU. So what's your take if I'm a candidate, conventional DDS candidate applying to OSU, what things should I be keeping in mind? What are they looking in candidates?
So, I for me, the way I'd answer that is you have to set yourself apart somehow. You have to be unique. And I don't know if it's enough anymore to just have good grades, some sort of service. A lot of people will like help out at a food kitchen for, a couple times and they check off the service box. Like the reality is everybody's resume looks like that. And so you really have to just have something, whatever it is, that really is unique to you. And I'll just share my experience. Um, is I worked at like a cowboy ranch in Colorado, actually, for 2 summers when I was in undergrad, and just kind of totally this different experience. I didn't grow up with horses or anything. I just, I went out and did it. And when I had my interviews at dental school, and this is not just OSU. I think most likely this applies to most dental schools, but um, I really believe over half of the time in my interviews, I talked about the range. I didn't talk about, you know, whatever, my undergrad classes or my service. It was really about the ranch, and it was because the interview people kept asking me questions about it. They found it very interesting. Um, and I think I found a way to kind of tie it into dentistry. Um, for example, I gave people horse rides, and so I had to take these families who came and maybe had never ridden a horse, and they might be very anxious, and I would have to make them feel comfortable on a horse. I'd have to teach them how to ride a horse, so there's teaching involved, and I had to then somehow make conversation with the family for sometimes 2 to 3 hour ride. So you can see how easily those three things really coincide with dentistry. You're going to have to make people feel comfortable. You have to teach them. There's a lot of teaching involved, and then you have to just be able to make conversation. So I just use that as my example because I was a biology major. I just feel like if I didn't have the ranch, my resume probably would have blended in with everyone else's. And I think you can kind of put yourself in the seat of an interviewer. That would probably get a little boring, kind of hearing like that run of the mill, same response to every question. I think having something like the ranch for me set me apart, and it gave them something to ask me that they found interesting. Um, Obviously, working at a ranch is not going to be for everyone, but I think that's just an example to me that you really need just some sort of unique thing or unique experience that you can really talk about, and hopefully also kind of connect how that's could help you be a better dentist too. So that to me that's the biggest thing I could think of what made me get accepted, because I think other than that my resume was probably fairly average.
So if I say the cherry on the cake, like something that made you unique was your experience working in a ranch in Colorado and working with horses, and that made you unique and stand out. And that totally makes sense. That's something I keep telling international dentists a lot. And being an international myself, we, most of people like me who are coming from different countries, we tend to follow steps from people who were ahead of us, and we tend to follow till a certain point that we are trying to mimic them in all of their application.
Yeah.
And I know communication, writing your own story is a big thing, having your own narrative. And when I was applying, I even talked to you, I talked to Wes at that time. And having that personal narrative is very important. And it's just, it's something I preach a lot. I like to talk about this, like have your own story rather than having, there's I usually laugh on it, there's a word that is used as a quick way, like a marketing thing on online media, crack, like how to hack a system, how to crack a system, stuff like that, how to crack a GRE. And people try to use the same scheme to do everything, but I feel like with American schools, having that uniqueness kind of gives you the edge. And but finding that isn't that easy. So let me ask you, how many schools did you got interviewed at?
Well, I'm trying to remember. It's been a few years. I think that, so I didn't want to move far away if possible. So if I remember right, I only really applied to Ohio schools and then maybe like the surrounding states. Um, and I believe I actually physically went to three different interviews.
Which ones?
And Michigan
Hmm.
was what, and that was, yeah, that was like actually probably the best program that I got invited to. I think they're pretty highly ranked. And then I know I went to Indiana, and I really think mainly it was just because location wise, I was trying to kind of stay close to Dayton, which is where I'm from, and so yeah, I felt like and I don't, I'm wondering if maybe I actually heard of my acceptance to Ohio State early enough where I didn't have to keep doing interviews. I think that's possible, but I definitely had other opportunities. Um, so yeah, at least three of them.
Well, Ohio State is a big school. It's a big name in the field. So one thing that I wanted to ask is, you said like knowing your uniqueness when you're applying. So I know a lot of people have done a lot of things, but how did you thought about this? Like what were the steps, or what made, because you have a brother who was already in a medical school, your sister is in the medical field, uh, what made you think about, okay, this is something that will help me out to stand out? Like what was the process? If I'm a guy, if I'm a person applying and I want to find out that uniqueness in me, what should I be thinking, what should go through my mind? Because some
Well,
seem silly to me, but it might be fascinating to somebody else, right?
right. Well, I think, like you said, you just got to kind of think through your own story and think through, everyone's got a unique story, whether they know it or not. And so it wasn't like I did not go work at a ranch so, solely school, like because it just happened, and throughout my life, that was like the projection of my life. So I did, and it just happened that when I was going to dental school, I was able just to recall this story that happened in my life, and I guess I focused on that. Like there's probably a few other life experiences that I could have focused on, but I kind of narrowed it down to the most interesting part. So yeah, I guess, maybe you purposefully do something to set yourself apart for dental school, but I think probably what works better is that it's just something that naturally happened. It's a part of your story regardless. And because that's I think when you're talking about it, it's going to come more naturally. just something solely for a dental resume, I think a lot of times as you talk about that, it can come across a little fake. So the more that it can just be like a natural part of your life story, probably the better.
And I can think of this in a different perspective. Like sometimes talking about a story that shows our weakness or showing our simplicity or showing that how vulnerable we are or how much of a commoner we are is actually much makes you much more of an acceptable person. I think at least in US, the it tells how much authentic or genuine you are. And I was talking to a couple of candidates. Sometimes people want to tell stories that get them a lot of I would say that tries to bring them up as a victim. And I try to tell candidates, if you have something which was difficult in life, do you talk about it? If you've done some rough jobs, something like that, working in a ranch is no easy job. And if you've done something difficult, make sure by the end of the story you say that you learned something good out of it. Don't make it a story of misery and just hardship and victimizing yourself. That's also, I feel, very important, because you kind of brought the tail end of the story and joined it with dentistry. That was the key element, I think.
Yes, I agree. I think that's the two parts I can think of is to have the experience, but also um, be able to spin it as how did this experience make me a better dentist? And so, yeah, if you can have those two things put together, I think you're gonna have a lot of material to talk about at your interview.
True. So let me ask you another question. So people like me who are going through school, which is no easy job, it keeps you busy. There's a lot of computer work, notes, lab work, didactic. How was your time, like when you were surviving? And if you feel comfortable talking, you told me, and I know this too. There's student loan, there's coursework, then the whole imposter syndrome, and then coming from a background where you feel you're not as privileged as the people around you, that's also something that you keep thinking when you're in stress. So how was your experience?
Well, um, I, I I did want to I wanted to make sure I shared on my talk with you that I did deal with a lot of anxiety. I still do to a point. That's a little bit, I think, just my personality. I'm maybe more prone to anxiety, but I know it was a much more intense in dental school. Um, and that does come, it comes from just the pressures of uh, trying, like I was saying earlier, if you try to put on that mask that you are getting everything and that you are, perfecting everything, that certainly increases the anxiety. I think for me, finances played a big part in that. Because I was not someone who came from a lot of money. My family did not. And so, I had some debt from undergrad, but really dental school, it took off. The debt escalated quickly. And so I think as I'm going through dental school and realizing, hey, this is hard.
Yeah.
I'm not picking, it takes a long time to feel confident in your dental skills. So, there's a lack of confidence and your debt's accumulating. And so I think those doubts start to arise of, well, did I do the right thing? Um, am I in the wrong field? But the debt makes you feel trapped because you feel like I have to be a dentist to be able to pay this debt off. So I'm sharing this because I think that a lot of dental students probably go through those phases, but I want to also make sure I encourage everyone that it'll be okay. I mean, dentists, we make enough money to pay off our school loans, and the confidence will come. You know, no one's going to feel confident in all their dental skills when they leave dental school. It takes a few years, and I'm 6 years out, and I would say I'm, just kind of finally feeling like I'm a true professional. That I can do all my procedures and not feel nervous doing them. But that's a lot of time. Um, so I think it took me just a couple years for my confidence to grow, and then to also see at the same time that my debt payments were very doable. That I was making enough money per month to easily make my loan payment. But I think those are very real feelings that everyone goes through, and I think everyone deals with anxiety in different ways. I will just say that for me, my faith did have a big part of that. Um, I'm a Christian, and there's a lot of amazing promises in the Christian faith, as in terms of God being there for us. He's very personal. He is living in us with this Holy Spirit, and so he says, if you have any worries or any anxiety, just go to him in prayer, and he will, he will take those loads off you. I wanted to share a scripture, if that's okay. One that I've really rested in a lot during this time, and it comes from the book of Philippians,
Sure.
chapter 4, and it just says, rejoice in the Lord always. I will say it again, rejoice. Let your gentleness be evident to all. The Lord is near. Do not be anxious about anything, but in every situation, by prayer and petition, with thanksgiving, present your requests to God. And the peace of God, which transcends all understanding, will guard your hearts and your minds in Christ Jesus. And
So I have a question on that. So I do understand the fact, the verse that you said, but if you were talking to yourself about 5 years ago and you're going through that stress where you're sleeping 6 hours, 5 hours, personally, I do not do much of YouTube anymore because I feel like you have to set your house in order before you go out and talk to anybody. So I've been focusing on school very much, and what helped me recently is that I try to wake up at 3 or 4, which is not me at all, but I didn't had any other option, and it has actually helped me. But in practical sense, what step, and I know it's been like when you sleep less, your grades are not going good, people around you are going much more faster, their exam. What practical stuff, like how would you implement these words in your practical stuff if you're talking to yourself back like 5 years ago?
because you're right. I am I have learned a lot over the last 6 years. So I can't say that at this time in dental school, I'm sure I had many stretches where I didn't go to God with all my troubles. I tried to internalize them and fix it all myself. But yes, if I, looking back, when if I'm in a good state of mind, right, and I can think clearly, I would tell myself, um, our identity is not in our performance. Um, we are children of God. And so I think knowing that, being the best dentist is not where my worth is at. Because if something happened to my hands and I couldn't be a dentist, well, where would my worth be? It would be ruined. Could be taken away from me. You can say that about almost anything. If you put your worth in anything but God, um, that thing can be taken away. Your health, your family. I mean, these are all bad things, but you can become sick and you can have family members die. So I think realizing that the only consistent thing in our life is God. And so that has to be where our hope lies. And that, to me, that brings a lot of peace and it takes a lot of weight off of me. um, realizing that I don't have to put all of my worth in my performance as a dentist. So that in my best days, I think about those things more clearly. Certainly, I have days where I feel more anxious than others, and I think I lose sight of that. But the more I can keep that in mind, I think the more peace that I can live with on a day-to-day basis.
So, in a practical note, what I can extract from what you're telling me, and correct me if I'm wrong, is that sometimes our anxiety during the dentist school is coming out of anxiety of a rat race. And if we keep a peace in our mind, peace of God, as you're mentioning, and let time flow and give it some time. And as you're mentioning now, you're 6 years after your graduation, and things have eventually gone a- upstairs, like they have gone to a better level. And it
Mm.
took time. And I do personally believe some people are really good with some skill and they can catch it far better than somebody else. But by the end of the day, it's practice, right?
Yeah, yes, I do think I just needed more time being a dentist, for my skills to get better. Um, and I do think that even for the best, that's going to take several years to get to that point. So during times where I felt like I really, had to rely on God more. Now the challenge is once you feel like you've arrived and you feel like you're a pretty good dentist, the challenge is not forgetting about God and saying, "Oh, I've got this. I can, I have my life in control." Because, like I said, if I start putting all my worth in being a good dentist, and something happens to my hands, like some people would have a big life crisis at that point because they have lost what they put their worth in. So I think for me, the confidence and the skills will come, but as they come, to not become prideful in yourself or to not start, you know, uh, basically feeling like you're the best dentist in the world. Because again, that I think that's where people, if something were to happen, they would potentially have a life crisis because that they put all of their worth in would be taken away from them.
Makes sense. So, what, why did you ended up, why did, when you were looking for work and when you were thinking about future perspective, uh, so what differences did you see in a private practice and corporate dentistry is big, and then working in a community health center? I'm just if you were giving advice to somebody who's graduating right now out of a AEGD or out of a college, what's the difference between working in a private practice, corporate, or going for a community health center?
So I've only worked at a community health center, so I can't speak totally about the others, but I will say, um, for me, a big appeal to staying at the community health center was working with the underserved. That's something that I always had a passion for, uh, and I think doing that in a way that, because there's really kind of two options to work with underserved. There's a place like mine that, because we get government grants, we're able to basically offset the cost a little bit. And so we can practice dentistry, I believe, largely like a private practice dentist could. Like we're treating everyone the same way. I think the other type of office that might see the underserved or see Medicaid patients, uh, because they don't get reimbursed a whole lot, they end up just seeing patients like over, they're just rushing through everything they do very quickly. Um, some corporate dentist offices get that reputation where it's almost like it's a production mill. It's how many patients can you see in a day? And sometimes they even give like production goals for the day where they might say, "Hey, you need to do 3 crowns today." And I don't think all corporate dentistry is like that, but you have to be careful because I think some are. Um, I have never had that sort of stress at the community health center. I've never had any sort of production goal. I get paid a flat salary, so I don't have the pressure of. I think some people would feel a lot of pressure to maybe treatment plan a crown that doesn't need to be done because they need to pay a bill that day or something. And I think that leads to a lot of, ethical concerns. I love being at a place where I can just do what's best for the patient. Um, and I don't have to worry that by doing more or less, it's going to fluctuate my earnings. So I feel like that just fits me the best. Um, I also just personally don't feel super driven towards owning a business. So at a health center, we have the business side is basically taken care of, and I really like that. Um, that's obviously not how some people are wired. Some people really want to be a business owner, and so I think those people, should look into more of a private practice office. But if you just want to do dentistry and not worry about some of the business things, and you want to be able to do the patient do exactly as you should for a patient and not have some sort of person overhead telling you, how many crowns you have to do that day. I think a health center can be a really nice option. And I'll also throw in um, most community health centers offer some sort of loan repayment, and I've been a part of that program. So actually, there's a state program and there's a federal program for like where I work at. My program's called the National Health Service Corp. You can go to their website, but as long as you go to a clinic that is considered um, like that serves the underserved, and they have a list of ones that qualify, you can actually get a certain amount per year paid to you to for loan repayment. So that's been another way that I've been able to help pay down my student loans.
That makes sense. So what I don't want to take more of your time, but one question that I've learned that in US pediatric dentistry is quite on a boom overall in community health center, private practices, hospital. Why is it so? Is it the Medicare that giving it a push or the government? But why is even getting a residency in pediatric dentistry is quite a big thing now?
Mhm.
Why is it so?
I can only speculate. I think that partially be because of uh, like reimbursements. So, like for example, Medicaid, at least in Ohio, covered almost anything on a child up to 18 years of age. So there's just a lot of treatment options for them. I mean, you would always have a lot of patients to work on. I have a feeling it probably has something to do with like for example, I'm a general dentist who doesn't particularly like seeing kids. I mean, I would say that's not uncommon for a lot of people to feel that way, and so there is like I'm really thankful I have a pediatric dentist in my office because she basically sees all the kids from 0 to 16, and then me and 3 other guys see like all the adult patients. So I think there's just a niche for pediatric dentists, and I think because their treatments are much shorter, and you can do more per hour. It seems like their ability to actually make more money. A pediatric dentist is typically going to have a higher salary than a general dentist. I think because they're able to do a lot more procedures per hour.
So I was looking at a ADA website which said after oral surgeons pediatric dentists are the one who are being the highest paid right now.
Yeah,
And it makes sense if Medicaid in Ohio is paying, reimbursing all the treatment payments. That's quite lucrative to be a pediatric dentist up there.
yeah. And I think, I mean, a lot of pediatric dentists will get like to an OR in a hospital,
Yeah,
and they might do a couple OR cases per week,
they do.
and, and so they're getting basically, they put the kid to sleep, and they can do um you know maybe work on 10 probably in an hour, and with sedation, and you can imagine those things add up really quickly.
True.
um so that you why that reimbursement would be a lot higher. It's uh maybe I kind of joke about it. You really only need, when you do a filling on a kid's tooth, it only needs to last a couple of years. When I'm doing one on my adult patients, I want that thing to last 35, 40 years. So I spend a lot more time doing a filling than on my adult tooth than a pediatric dentist probably does on their tooth. And that's okay. I mean, I think in a lot of ways they have to be quick because kids also don't sit still very long.
Yeah.
But it's just a totally different world. I mean, it takes a special person to be able to work on young kids who are, wiggling and, a little crazy. Yeah, I guess I prefer to have a patient who sits still and I can talk to them. But it just depends on personality. I mean, some people, really feel
This,
drawn to pediatric, but don't do it for the money. I mean, I think it does take a special personality, and you definitely want to make sure that it's something that you would enjoy doing. Um, don't ever do anything just for the money, because that will make you very miserable.
true, true. So we end this interview, Logan, first of all, thank you for your time. It's I know being it's your time is precious at this point. I wanted to ask, what would be something that you would tell yourself or any other candidate who's applying to a dental school or a residency and who's been getting failures after failures or maybe not getting his silver lining? What would be your word of advice to that individual at this moment, or what would you say to yourself right now?
Well, I'd try to just encourage you to that it's worth it. I mean, I certainly went through some days where I was questioning dentistry myself, um, just in terms of, will I ever really enjoy it? And I think that largely just came because I was failing, or I wasn't doing very well. I felt like I was never going to pick it up. Um, Fast forward 5 years, and I feel confident. I feel like I can take care of a patient, and I have so many rewarding appointments. Times where someone comes in and they're just in so much pain that they can't even. I mean, they can hardly function, and they leave a half hour later, and they're smiling at you because you took care of, you got rid of their pain. Um, or someone who just has, terrible teeth, no smile, and you can make them a denture, and they leave with a big smile on their face and and crying. Like, dentistry can be very, very rewarding, um, and it just has a little bit of a bigger learning curve than a lot of occupations, so it takes longer to get there, but it will come. And uh, I still think it's a fantastic career. It's great lifestyle. Um, I mean, you can easily work, 8 to 5 on work days or on weekdays. Be with your family still in the evenings. Have a salary that you know allows your family to live very comfortably. So you will definitely go through stretches where you doubt yourself and doubt the profession, but if you stick with it, it will be worth it. I still think it's just I have no regrets. I would do it all over again.
Makes sense. Makes sense. Thank you for your time, and I hope we'll talk to you soon again.